Welcome to the study group exercise for week 7. Our focus this week has been primarily on cardiac pharmacology, and so I'd like to extend this in our session for this week. So last week you went through a chart called Marjorie Stevenson, and this week I'm going to have you access the second chart in this program, which is called Mr. Jonathan Ponty. There's two parts to this chart, and the one that we're going to work through is the one that I have posted in part 4. If you've gone through the cardiac modules, you've also seen this chart in the second part of the cardiac medications as well. It's an exercise that I use frequently with my students. What I like about this chart is that it shows you the progression of cardiac disease, and it looks at a client who actually is quite severe in his process with coronary artery disease and heart failure. And so he is really at the end of his medical management. What I have in this chart that I think will help you are some angiography reports and then also TEE reports and looking at his ejection fraction, etc. But what I think is particularly valuable in this chart is looking at his assessment findings and making your priority nursing needs based on a client who's on multiple drug therapy and really, his treatment is at an end stage where, he's really relying on nursing knowledge and teaching at this point to help him from having, exacerbations of his heart failure. So go through the chart within the group. Talk about Mr. Ponty's main priorities and really, again, look at his drug list. This is an opportunity for you to study pharmacology together. So please look at the actions of the drugs, what you see as the most serious side effects, and then see if you can catch any drug-to-drug interactions. And then once again, please look at his lab values, make sure that you have an understanding of them, and talk about what an assessment would look like if any of those stated values were high or low. If you have any questions about the chart, by all means, you're free to email me. Keep notes and remember that this is a tool for discussion. So move your discussions, throughout your group session and really challenge yourselves around the key content areas.